Although there are many different ways to treat fractures, it's highly important to identify when one has actually occurred. A fracture is a broken bone, which may be broken into 2 or more pieces, or it may have a linear crack. If there is a wound at or near the break, this is said to be an open fracture. If the skin remains unbroken, they are described as closed. Fractures can be stable or unstable. It is important to recognize the difference, as moving an unstable fracture can cause further injury. There are several indications that a bone is probably broken. A heavy blow or other force may have been applied to the body or limb, or the casualty or an observer may have heard the bone break. If so, they might experience intense pain, especially when there is pressure or movement at the site. Swelling will almost always occur immediately, potentially followed by discoloration of the skin. Before we move on to the general treatment of fractures, let's consider some of the more difficult injuries that you may face. If you suspect a fractured spine or neck, you should immediately support the head and neck to prevent movement. Tell the casualty to lie still, and don't let them move until they are supported on a hard, flat surface. Any careless movement could damage or sever the spinal cord, resulting in permanent paralysis, loss of feeling in the legs, and double incontinence for life. Pelvic fractures can cause potentially life-threatening bleeding into the pelvic and lower abdomen cavities. On discovery of a casualty with a suspected pelvic fracture, start a pulse chart immediately and check for concealed internal bleeding. In the case of one of these injuries, or an open fracture, seek radiomedical advice early, because it may be necessary to evacuate the patient. Unless there is immediate danger of any further injury, the patient should not be moved until any bleeding is controlled and all fractures are immobilized by splinting. You should never elevate a limb with an open fracture, as this can cause more damage, such as severing an artery. If it is comfortable, fractures should be supported in the position you found the person. Any bleeding should be dealt with as with any embedded object injury, with rolled bandages on both sides and a dressing over the top. No pressure should be applied over the wound, as this could move the bone and cause more damage. If it becomes necessary to move an injured limb, due to poor circulation for example, you should gently move the limb until the pulse returns, and then support it in that position. Open fractures of joints, such as the elbow or knee, should not be manipulated. They should be placed gently into a proper position for splinting, which should only be done by the medical officer. Maintaining the circulation of blood is essential when treating a casualty who is suffering from a fracture or dislocation. Check and recheck the circulation by pressing on a nail. When circulation is normal, the nail becomes white when pressed and pink when released. Danger signs include blueness or whiteness of fingers and toes, and coldness or loss of feeling below the injury. Test for this by touching the casualty lightly on their fingers or toes and asking if they can feel anything.
Feel anything?
You must also check for a pulse. If the limb does not become pink and warm, and you cannot detect a pulse, medical help may be urgently necessary to avoid amputation. Remember that fractures may cause serious blood loss internally. Look out for signs of shock and treat appropriately. A dislocation is present when a bone has been displaced from its normal position at the joint. With this type of injury, movement is limited, and there is often quite severe pain. This is made worse by attempts to move the joint, which is distorted by the dislocation and swelling. The evidence for a dislocation is very similar to that of a fracture. And you should also remember that fractures and dislocations can occur together. The first aid for dislocation depends on whether it is closed or open. If a wound is present near the dislocation, it should be covered to stop bleeding and help prevent infection. Do not attempt to reduce a dislocation. A fracture may also be present, in which case attempted manipulation can make matters worse. Movement can be prevented in the affected area with suitable immobilization. Support slings are used for any injury in the arm, including the upper arm, elbow, forearm and wrist. Elevation slings are used for any injury around the arm, including the shoulder, collarbone, hand and fingers, and ribs. Once immobilized, look for impaired circulation and loss of feeling. If these are present and you cannot feel a pulse at the wrist or ankle, move the limb gently into a position in which circulation can return and keep it there. Look for a change of colour in the fingers or toes, from white or blue to pink, and transport the casualty in the most comfortable position. This is usually sitting up for an upper limb injury and lying down for lower limb injuries. Fractures and dislocations can occur in numerous areas around the body, and many of these require treatment that is above the level of elementary first aid training. If in doubt, remember to follow the principles of first aid and wait for more experienced personnel to arrive.